Hi, I'm Dr. Marcy. I'm a licensed physical therapist with a clinical doctorate in physical therapy. I also have a ton of certifications after my name, but most of you think that that means nothing. And that's okay, because you don't understand what I've done in terms of continuing education, and I get that. But in my degree program, we are taught differential diagnosis, and one of the primary reasons is that organs refer pain to the skeletal system. For instance, I had a 12-year-old girl come into me with severe low back pain. She had failed physical therapy for 2 years. Quick examination of her reveals that none of her pain can be recreated by a musculoskeletal exam. So, with the training that I had in physical therapy school, we learned to organ tap. Turns out this girl had a kidney that was failing, and guess who found it? Patient comes into me, 36 years old, complaining of neck and shoulder pain right through here. Common area for people to have pain. Musculoskeletal exam reveals nothing in terms of being able to recreate her pain, meaning I can't solve it with physical therapy. I start thinking back to my differential diagnosis class, start tapping on organ spots, and tell her, I think it's time to have an examination done with an ultrasound. It's possible that there's a bleeding ulcer in the stomach. They fixed that problem for her a week later. 42-year-old female who is postpartum comes into me with upper back and neck pain, kind of in between her bra strap area. She is nursing. People have told her that it's nursing mother syndrome. Physical evaluation says no, it's not. Do some palpating of the liver, press on one specific spot, sends her through the roof with her specific pain. It's gallbladder. Why might you want your physical therapist to understand imaging? Because if she had come to me with that imaging and said, I'm also having this pain, I could have said, this isn't something I work with. You need to see someone else. As a physical therapist, as a functional medicine health coach, it is something I work with. Somebody has kidney stones. There's a lot of reasons that kidney stones form, and there are a lot of things that we can do to help them dissolve faster so that when you pass them, they don't create pain that's causing nausea, vomiting, and you to pass out. It's fairly simple. Lyme disease is probably the most common thing that is misunderstood with what's going on with people and their migrating joint pain and autoimmune disorders, honestly. And honestly, until probably the last 8 years, for most people, it was just dismissed as not being a problem at all. Mold is still dismissed as not being a problem at all, and yet it causes so many chronic illnesses. It's sad that it is not better understood. My goal as a functional medicine health coach is to educate people about what their blood work says, about what their testing says, about what their epigenetics mean, and how they can change their environment to improve their health overall. It's educational information. It allows them to also have more information, because I also provide them with research, to go back to their doctor and say, I don't understand. You said this, and you said it didn't matter, but here's the literature that shows that it does. So can we have a different conversation now? Because with functional medicine, there are times when we need the provider to be on board because that person's going to need medication. I hope that helps explain what I do. What I do is provide an educational service to help people be healthier in the environment they're given and their epigenetics.